does your protocol help someone with cervical osteoarthritis and lipedema?
Yes. That's interestingly, it sounds like I feel like it don't sounds too good to be true, but when you actually have these spinal osteophytes, these spikes like needles that digging into your nerves that can cause pain. You have these osteoarthritic and nerve pain that runs down your arm or your leg or your back. It seems like how can the person get help unless for surgery? But the combination of what we do here with with the shockwave, it can break up the osteophytes because the original technology was used to break up kidney stones, and they found it can break up kidney stones with these water waves, water shock waves, electrical magnetic water shock can break up kidney stones without harming normal tissue behind the kidney, right? You're not going you're putting on the outside the body, and inside the body, it's breaking up kidney stones, and it's not harming the tissue between the kidney stone or the kidney. And it's magical technology. And now the same technology has been advanced further, obviously, to be able to leave more room, break up spinal stenosis, osteophytes, osteoarthritic lesions, and things that cause pain, that can cause chronic pain. So yes, the combination, we have the equipment and we have the knowledge and skill to help this person fix those problems.
Perfect. And Jill would like to know if the retreat can treat depression.
First of all, I have a tremendous lot of experience taking care of people with emotional disorders. And second of all, I have a lot of tools available to us. So yes, I'm knowledgeable, not just in the way diet affects depression, but using supplements and herbs. Like we have SAMI and 5-HTP and saffron. I even have a supplement on my website called Mood Balance Biotech, which contains 5-HTP, SAMI, and saffron. And we have multiple combinations of added elements we can do to help the people feel better than depression. And when they need drugs, when those things doesn't work and they've tried, let's say, magnetic therapy, and those things aren't working well, still there's other options that we can do to use the lowest amounts and least toxic ways to help them feel better. And I've had many people come here on medications, not on SSRI-resistant people who are not doing well on their antidepressants, and we switch them over to a different combination, lower the dose of the medication, put them on a different substance, and know exactly how to get them to feel better relatively quickly. So yes, we can take care of a person, but of course, it's not a hospital. We want we don't want people that are completely bedridden. It has to be they have to be able to get themselves here comfortably.
Pam says we need a cancer survivor retreat, but I'm guessing somebody with active cancer that probably wouldn't come during their treatment, right? They'd come maybe after.
Yes, that's true. We've had tremendous amount of people that come here with cancers, and don't forget there's three types of cancer. The one is the low aggressive cancers that are best treated without chemo, that are best treated with nutrition, and with the added elements of what we do here, and including the anti-cancer protocol with some fermented foods added in, they do exceptionally well. And then we have people who've had an aggressive cancer that required chemo, let's say, because chemo was indicated for that aggressive cancer, but some cells could escape the chemo, and that's where this nutritional program of nutritional excellence can prevent recurrence and can take care of the stray cells that escape the primary tumor and can help the person now survive. And I'm even in my teachings in the summits I'm running, I show one example after another of people who may have had a cancer in their past, even an aggressive cancer, that's now thriving and living 10 years later, 15 years later, 20 years later, 25 years later, including multiple people with metastatic ovarian cancer who have now survived more than 20 years and haven't had any recurrences because they followed this program. So it's the combination of the nutritional program and the special supplemental regimen geared to their condition. But keep in mind also that many people feel overwhelmed when they have a diagnosis of cancer. And the fact that they can come to a place and have the food be made for them and show them how to do it and adjust the juices and how to make the food and how to take the supplement regimen. So, they could speak to me and join the website, and I can communicate with them and they can get information, what to do this. But the fact that people can come here and have it actually, do it with them and teach them how to do it, and they can get a feel for it. It helps them a lot for them to continue the process when they leave, because it's not because this is what's wrong with cancer treatments and cancer places you go to. you can't fix this problem in a week or two, right? This is a problem that you have to have this person adopt a new way of living that they're going to do for months or the rest of their life, for years even, right? So they've got to get this down, how to the right way to live and the right supplemental regimen and the right kind of make the food and the juicing so they've got to get it right so they know how to do it when they get home. And so we're showing them how to do it long term. Whereas you go to this place, a cancer place in Mexico or something, and they're giving you this special diet. But what good is that? It's not going to help you. You got to know what to do for the rest of your life, not what you do for them. They're giving you special treatments. They're giving you ozone. They're giving you apricot pits. It doesn't work. They're giving you stuff. If it was effective, then you would have needed to do it ongoing for months and even years. What you do in 1 week isn't going to solve anything, unless, of course, we're talking about conventional therapy. Chemo is different, but the nutritional stuff, the nutritional interventions have to be incorporated long-term in a person's life. And that's what we're teaching. We're getting people comfortable with that so they know how to do that.